Or if it's a 5, 10, 15, or if it's a 10, 20, 30 kind of a dial. You don't want to elongate, so set at +5. Then what you're going to do is set your horizontal angle in line with that jaw. And I just kind of move the PID out of the way. It's always white to the bite, dot to the slot. Don't forget to put the dot nearest the slot so that it's ending up in a non-diagnostic area. Also on molar films, I offset the film to the distal so that the patient doesn't have to have the stave as far back in their mouth. I open up my dexter and always move the tongue out of the way. You can't put the film on the patient's tongue or it won't seat down and get the apex. Now I'm going to stand at the side and I'm going to seat the stave on the occlusal surface. That's also very important that you're seating it all the way down there before you close your dexter. I'm going to look from the patient's side, run my finger off the mesial portion of the film to make sure that I'm covering the correct tooth. If I just look from this direction, it's not a real accurate view, so please ask that you do that. Close your dexter up so that the stave stays in place where you had originally seated it. Now, only for this mandibular molar film, here's a little trick that'll work. So that you don't cone cut in an up and down direction, because the VA is +5, you can just run your palm off the bottom of the PID and you should be okay for not cone cutting. Run your finger off the mesial of the PID and you should about touch the cuspid, and that should be in the right area. Do you guys have any questions? I can press pause. Mandibular premolar, so we'll get our long stave, mandibular premolar, get our long stave out. I usually just load the stave in the middle. I soften up the bottom mesial part of the film with my palm because I know that that's going to be very tender for patients. So I will set my horizontal angle with the jaw line and then set my vertical angle at negative, but I'm not sure what it'll be. I have to look at that later. Open our dexter, move the tongue out of the way. Now you're going to just place the film angled across the arch. So I look from the side, measure with my finger to make sure that all of the cuspid is covered. The stave is seated on the mandibular occlusal surface of the teeth. I gently close the dexter to keep that film and stave in place, and then I look from the front of the patient and I angle my film with the PID to make sure I have the correct vertical angle, and then I'll run my finger off the top of the PID to make sure I'm covering the stave, and off the mesial of the PID to make sure I'm covering the film. And usually your finger will about just clear the whole arch from the mesial for cone cutting. Any questions?